She was sent home from the emergency room with a strained left arm. The family told the doctor she'd barely moved all day, but they didn't listen. 30 minutes later, she was dead on her garage floor. Local police and EMS were standing over her body before her papers were even cold. We've been told to think of a heart attack as someone clutching their chest and collapsing, but if you're waiting for chest pain, you might be waiting for your own funeral. I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, please like, share, and follow. I see the tragedy play out constantly. We call them atypical symptoms, but for nearly 40% of patients, they are the only symptoms. When your heart muscle is starving for oxygen, your nerves get confused. They send signals everywhere and sometimes not to the chest. It's the jaw that feels like a toothache. It's the strain in that left arm when you haven't lifted a finger. It's the sudden flu or exhaustion that hits you like a freight train. Now, if you're over 70 or if you're a woman, your heart really screams, it whispers, and the ER staff, they may not be listening. You may have to make sure they do. And why did that grandmother die? Because in the elderly, pain perception changes. A heart attack can look like a fall or a fainting spell or a sudden confusion or arm pain. And for women, you're statistically more likely to be dismissed because you're told it's anxiety, reflux, or stress. Now listen to me. If you have sudden pain anywhere in your body, from your belly button to your jaw, or if you're sweating for no reason and you have risk factors for having heart disease, well, it may be a heart attack until the cardiologist proves it isn't. Here's the rule that saves lives. If the story doesn't match the diagnosis, don't leave. If they tell you your 85-year-old mother has a muscle strain, but she hasn't been out of her chair, you demand a serial EKG. You demand a second set of troponin enzymes. You demand a consult. One EKG can be normal in the beginning, and one blood test may not show that leak of troponin. Stop looking for chest pain. Start looking for the truth. It's your life or your mother's life on the line. I hope that helps.